All right, if you have been following along or watching any of my other videos where I talk about Alzheimer's, you already know that this is a topic very near and dear to me. I've spent a lot of time in the last 2 years trying to find out as much as I can about the disease, how, just anything I can find out about it. And it's both fascinating and sad. However, information is knowledge, and knowledge makes us able to better cope, deal with, and prepare for things that may be coming. Now, with Alzheimer's, one thing I'd like to stress with any of you out there that may be concerned about a loved one or family member, or maybe feeling frustrated at, what may seem like a doctor or healthcare provider maybe dragging their feet and not being quick to give a diagnosis. It is not a disease that is instantly diagnosed by a doctor the minute you show up for an appointment and exhibit, a difficulty with memory recall and some foggy, mixed up thinking. A lot of times, in most cases, Alzheimer's is not actually diagnosed till about stage 4. And the reason for that is, as we get older, we do become more forgetful. Now, my grandmother had a terrific memory. Up until the day she died, her brain was like a steel trap. Okay? However, you have to be realistic and take a step back and realize that as we age, as we get older, the more things we have to think about and remember and keep track of, it's like the brain gets used. It gets worn down a bit. So thinking, memory recall, forgetting where you put your keys, just those can be very much normal behaviors that we see in people getting older. So the minute somebody is struggling to find a word, just like I did now, or they come out of the shopping mall and they can't remember where they parked their car right away, does not mean that they have Alzheimer's. Okay, there's a lot more that has to be present. There's a lot more things that a doctor is going to look at and test for before jumping in and making a diagnosis. Because the last thing we want also is an improper diagnosis. All right, that would be terrible. So it's normally. In most cases, a diagnosis is not made till about stage 4, because those first 3 stages of Alzheimer's are actually considered not having Alzheimer's because they're more present in just the normal aging process in the brain just slowing down, all right? And even at stage 4, there has to be very significant, very noticeable, very drastic changes in a person's behavior. And a lot of times that comes down to the person or people that are with this individual almost 24/7 or most of the time. Because when you take, say, a couple that have been married for 50 or 60 years, who is better going to notice that, well, that is just very out of character, a very noticeable extreme difference. All right. Now, in looking for a diagnosis, whether it's, I would never say hoping for a diagnosis of Alzheimer's, but if there's someone you care about, or if it's yourself and you're looking for a diagnosis to get answers, there are certain things when it comes to Alzheimer's that doctors will do. They'll perform a series of tests, not just 1 or 2, but a series of tests. They'll probably do some scans on the brain too to get a look inside and see what's happening, because we do know that with Alzheimer's, their plaques can form in the brain, that hard substance that makes it very hard for messages and to cross the barriers and for brain cells to talk to each other. So there's several tests that doctors will perform, and just a few of them are things like, really measuring and trying to get a very good baseline as to, or a good measurement of just how impaired is the memory. And there's little tests and questions, it's just sitting in a doctor's office, things that they will do with a person in terms of saying things and telling stories, or just like a conversation, asking that individual to repeat or ask them to remember things that were said. So, I'm making it sound very, very simple, but they're the doctors. They know what they're doing. These tests are designed to pinpoint, is this a cognitive neurological disorder, or is there something else that might be going on that we need to look into? Another test or something that they will test for or try to test for is changes in a person's behavior. And with Alzheimer's, as a person declines, there can be some very drastic changes in their behavior, irrational. They can become very aggressive. They can act in ways that are socially inappropriate. So that's something else to take into account. Again, just because someone starts doing that does not necessarily mean it's Alzheimer's. It can be something else. But this is one of the things that they will look at. They will do their best to try as well to measure the degree of memory impairment, because as I keep saying, and I think I've said it in almost every video I've done, as we get older, our memory may not be as good. And that's a normal part of the aging process. It's nothing meant to alarm or to be scared of. It's just life. It's part of getting older. Let somebody else remember things for you. But if it does appear and seem that the memory impairment is extreme, or the inability to recall is very extreme, they will try to measure what degree that is, because there's normal aging and then there's what would be a red flag. All right. They will also want to determine just how much normal daily life activities and just living has been affected. Okay. So that would be, again, the behaviors, possible outbursts, the degree of which memory is impaired, the degree to which the inability to recall things, getting lost along common routes, like and I think this is something I've repeated thousands of times, but if, every day for 30 years, mom got up and drove to the grocery store the same route, every Wednesday did the same thing, just like, very, very clockwork-like, and all of a sudden can't navigate her way there or back and is getting lost, that can be a big red flag that, there's Alzheimer's or some neurological disorder going on. So, and that's affecting daily life. If, they cannot leave unassisted because they get lost. Another, it's not really a test, but they're going to ask a lot of questions and do some digging to make sure that there isn't another possible cause. Again, we just don't want to take Alzheimer's off the shelf and go, you have Alzheimer's. What if, what if there's another reason? What if it's something viral? What if it's a bacterial infection? What if it's an injury or an old injury that's, they're going to rule out as many other possibilities to make as accurate a diagnosis as possible, because at the end of the day, what you want answers, because with the answers you can plan, you can prepare, you can make arrangements, you can do your very best to care for somebody who needs your help. But you also want an accurate diagnosis to know exactly what it is you're looking at and dealing with, because there would be nothing worse than being told something and that not being true. So if you're feeling frustrated, if you're someone in a situation where you feel there is a possible, could be Alzheimer's, could be dementia, some sort of neurological disorder that's causing cognitive decline, and you feel like you're waiting on a diagnosis and it's not happening, you may have to push a bit. I'm always be an advocate for your own health. Sometimes the squeaky wheel gets the grease, but also keep in mind that when it comes to these diseases of the brain, these disorders, a doctor isn't just going to want to label you right, the minute you walk in and sit down and spend 20 minutes with them, okay? They're going to probably take their time. Sometimes it may feel like too much time, but you want to know what's going on. You want to be sure that you're getting the truth. You want to be sure that it's accurate, because that's the only way you can actually prepare yourself and family and people around you to be ready and be as helpful and be as supportive of each other and support the person going through this. Thank you so much for watching today and hearing me out. I hope the video helped. I hope it maybe gave you a bit of relief, or, if anything, maybe it gave you more questions. Go to your doctor too and ask them. But if you liked the video, please share it with friends and family. Absolutely give us a thumbs up. If you haven't already, subscribe to our channel. We've got lots of great content. There's lots of stuff in there you're going to love, and there's lots more videos on this topic. Again, thank you so much for joining me. My name is Tonya. I'm the holistic health practitioner here at Critical Bench. Have a great day.